Everybody else is, with my nurse practitioner, doing quantums. And we'll build what that looks like. So the quantum is the latest drop in 2025. It's a single cannula, so no outside. This only goes inside through a tiny little poke hole. You have a 10 and you have a 25. Bipolar radio frequency. Remember the tights. The energy comes from the inside, goes all the way up to the skin. The energy is just isolated right at the tip of the quantum. So it is still bipolar, but you have a positive proximal probe and a negative distal probe. And the bipolar energy is just going from positive to negative right at the tip of the cannula, not in between two tines. So you can see the degree of aggressiveness, tights versus quantums. But the cool thing about the quantums is, when this goes in, you can do it wide awake with no tumescent. Just a little lidocaine. It's only numbing for comfort, not for safety. For the tights, you're laying down so much energy, you need to insulate that soft tissue envelope with a bunch of fluid, tumescent fluid. Here, I just need to make sure you're comfortable. So just a little numbing shot. And this is Andrea, my nurse practitioner, doing a submentum with the quantum 10, no liposuction. Okay, so this is how it's kind of positioned in the practice. It's a single treatment. Now, of course, someone always says, well, can you do it again and get a result? Yes, yes. But the way it's positioned in my practice is a one-time treatment, and this is why this is important. What did I tell you guys? Some of you missed in the intro. What did I tell you guys the patients want in 2025? Real results. And what did I tell you the market needed? A way to do this with a minimal amount of treatments. This is your quantum. So let's play this out. Let's put some handles on this, some wheels on this. My challenging patient before the quantum was a younger 33-year-old female, mother of one with minimal skin laxity, but a little bit of submental fullness. You got her in your head? Okay, providers. 33-year-old female, mother of one, little bit of submental fullness, no laxity. You got her in your head? What are our options? Help me out. We're all in the same space. We're all colleagues. What are your options? A little bit of fullness. She's complaining about a double chin. Cool Sculpt Mini. Kybella, Morpheus, chin projection, that will help, but we're not treating the submental fullness, but I like it, thinking outside the box. Here's my point. Everything that we mentioned, and this was the world that I was living in and struggling with, everything that we mentioned as opportunities, we all have, or a version of it, requires how many treatments? Even with my Morpheus, I'm deep, I'm fixed, I'm double, triple stacking, trying to melt fat, and you're having to do 3 of them, 4 of them, try to get any needle movement, or you've got your Cool Sculpt Minis, that's like you got to do 18 million of them and deal with all the challenges with that, right? This patient now, a one-time quantum treatment, gets you a 25% reduction in the soft tissue envelope. And that's treating very conservatively, but I would give you a conservative number. So if my tights are 40, this is 25% with no lipo. One time, 25%. Does everyone, just as a way to contrast, I'm not bashing. I'm not trying to bash you. I'm just here to tell you my experience and represent InMode. But does anyone know the literature, the foundational literature for the cryotherapy opportunities? What is the best that on record in the literature, what is the best that can achieve? Up to 20%. Up to. How often are we seeing 20%? You know what I mean? It's yours to debate. But my point is up to 20% with 6 and 8 and 10 treatments, right? This is 25% consistently one-time treatment. Do you guys see the difference? It's a real result with one treatment.